Thank you very much. I'm just going to try to do this short, simple, and sweet. Just trying to tell you a little about the magnitude of the problem. How did I do this? Oh. Yes. It's coming again. Yes, it was very short, but not so sweet. Yeah.
Just the mouse.
Okay. Heart failure has been an increasing problem, and it has been suggested that actually in the future this will be one of the major activities in cardiac surgery. It's estimated that approximately 5 million Americans have heart failure, and there are more than 500,000 of new cases every year. And it contributes to approximately 300,000 deaths in USA per year. And as we can see from these survival curves, the prognosis once the patient has got heart failure diagnosis is like the prognosis for a cancer. You there's a little difference in the survival of men and women, and actually men are doing worse than women once the diagnosis has been made. But an overall mortality is approximately 50% mortality after 3 to 4 years. So this is a very malignant disease. This is one trying to show how the amount of heart failure is influenced. And if you look here, you have an elderly population. This tends to increase the amount of patients with heart failure. Diabetes, obesity are the same. And then more people are surviving with coronary artery disease. And also you have more active diagnostics. All these things will tend to increase the number of patients with a diagnosis of heart failure. On the other side, the incidence of acute myocardial infarction is going down. This will reduce it. We have better treatment of patients with coronary artery disease, and the severity of acute myocardial infarction is also lesser now when we have the very active PCI. So these things will tend to decrease the incidence of heart failure. And once you have patients with heart failure, then there's a balance between those that die and the incidence. And what happens? We have deaths, and then we have admission to hospitals, and we have the survival. So all these things here will influence how the level in the bucket will be. There is a suggestion now that actually there is a balance between the new number of patients with the heart failure and the patients that die. And so there isn't really an increased incidence, but because the number of patients getting older and older, there may still be a tendency that the total number will increase. Sorry. What has been of special interest for surgeons is the fact that even if the patient with heart failure traditionally is with the cardiologist, it's also something where surgical maneuvers can have an impact. And it is particularly interesting that patients on an assist device with unloading on the heart can actually reverse the heart failure, can reverse the left ventricular remodeling. And if you see on this, you see how pressure volume in the normal heart is in the heart with heart failure, and after being on the left ventricular assist device, the pressure volume relationship is going back to normal. And here you see the myofibrils and the cardiomyocytes being big and swollen with heart failure. This is a normal heart, and after left ventricular assist device, the cardiomyocytes are coming back to something in between in normal. And this is actually something showing the same thing, the strength on stimulation of the cardiomyocytes in heart failure. And this is a normal, and after left ventricular assist device, it goes from this to this. So there is a possibility to have a reverse functional remodeling. And the reverse modeling is both functional, is an electrical reverse modeling, and also remodeling of the extracellular matrix. And there is a reverse remodeling on the molecular biology of the heart. And this is actually very interesting, because by having surgical maneuvers like a left ventricular assist device, we can change the gene programs of the heart and then induce the reverse remodeling. And you are going to hear a lot about this later on the molecular biology of the remodeling as well as the reverse remodeling of the heart. So the molecular reverse remodeling includes extensive and varied changes in gene and protein expression. And actually, to study these changes offers unique opportunities to identify the gene and molecular changes associated with or responsible for recovery. Because if we can identify these, we can then maybe be able to stimulate them and change the molecular patterns of the heart back into those genes or those gene pathways that are responsible for the reverse remodeling. This summer, there was a lot of attention in the media to this particular patient that was published in The Lancet about this girl who at the age of 11 months underwent a heterotopic cardiac transplantation with her own heart still remaining in the chest. And because of problems with the donor heart, this was removed 10.5 years later. And then her postoperative course was uncomplicated, and her own heart had regained function. And not only function, but 3.5 years after the transplanted heart was removed, her own heart had normal function. So this shows that it is possible to get the heart back to its normal state. So what can we do? We can identify the gene and molecular changes associated with or responsible for recovery. We can also identify predictors of recovery. And by doing this, we are able to identify new therapeutic changes to initiate reverse remodeling, promote reverse remodeling as an adjunct to other surgical therapies, and also be able maybe to trigger the right genes as the sole treatment of heart failure, and thus induce left ventricular remodeling. And I hope that today can be a stimulus for the interest for the genes of the a reverse remodeling, because this is a field where cardiologists, basic scientists, molecular biologists, and surgeons are thematically knotted together and must collaborate closely in order to solve the problem. So, thank you very much.